We're case study number 5. My name's Brittany.
I'm Caroline. I'm Christina. I'm Cassidy. I'm Allison.
So our case study is Jim Lawson is a 64-year-old Caucasian male admitted to the hospital medical floor for a respiratory infection. Jim, a 2-pack-a-day smoker, has a history of chronic obstructive pulmonary disease. He awakened in the morning with increased shortness of breath and coughing with the production of green-brown sputum. Vital signs are BP 144/88, pulse 94, respirations 30, temperature 100.2 orally. Physician's orders include ABG stats, sputum for culture and sensitivity, then begin ampicillin 500 milligrams IV every 6 hours, IV D5W 100 cc's an hour, theophylline once daily, albuterol 3 milligrams per nebulizer 4 times a day as needed for acute dyspnea, oxygen 1.2 liters per minute. Jim has a wife and 2 children at home. Jim was laid off from his job 1 month ago. Jim does not have any medical insurance and does not know how he will pay for his medications.
Jim Lawson is a 64-year-old male who presents with shortness of breath and coughing up green-brown sputum. He has been a smoker for a long time, which contributes to his COPD condition and respiratory infection. The physician orders many tests to be done right now to figure out his alarming symptoms and orders albuterol, which is a short and rapid acting, to help with Jim's shortness of breath. He orders arterial blood gases right now, sputum culture to test if there's any bacteria in his green-brown sputum, ampicillin IV, IV D5W, Theodor albuterol nebulizer, and O2.
Jim's economic issues. Jim has many economic issues that are going to affect him during his hospital visit. He was laid off from his job, which shows he has little to no source of income. He is also caring for a family of 4, which requires a lot of money to be spent. He also does not have any medical insurance to help pay for some of the medical bills or the medication. He is unsure how he would pay for his medications because of all the conflicts stated. How Jim's economic issues affect his care. Economic issues have a big impact on Jim's care and could lead to his symptoms to get worse due to him not being able to pay for the medications needed. Jim also does not have insurance, which will influence him to not want to have any more doctor's appointments since he will have to pay for all of these out of pocket. Without a job, Jim has no source of income to pay for extra medication or doctor visits. He also has a family to support, which will be his first priority over his medications.
Jim will need to learn drug management in order to improve his personal health. As the nurse, it is important to teach him how to use each medication, educate Jim on what each drug is used for, and document all of his assessment findings. The nurse will also obtain an order for a spacer, which can aid Jim in delivering the right amount of medication. Provide Jim with a paper to take home on all the education that is provided so he doesn't forget anything. How to properly use each medication using the teach-back method is important to do for each patient upon discharge in order to ensure that the patient knows how to use each medication properly and that they are fully knowledgeable on their current healthcare status. Educate Jim on how to use each medication for when he goes home and why he's taking each medication. Lastly, assess and document Jim's vital signs throughout his stay at the hospital.
Healthy ways to improve Jim's conditions are to identify the triggers that cause his coughing and shortness of breath, have him take rest between activities to preserve his oxygen, and education on proper nutrition, like drinking a lot of fluids. It is important Jim learns ways to improve his health besides using the medication prescribed, because it will save him more money in the end result by taking preventative and natural methods to being healthy. Try to advise him to stop smoking or decrease the amount he smokes in the day, which will really help.
When thinking of the rationale for implementing this plan, the desire is for the patient to receive effective care. Having the patient use the teach-back method to show and to demonstrate the skills allows the nurse to be confident in the patient's ability to treat himself without the healthcare staff present. The use of a spacer device causes the patient to become less likely to waste valuable and possibly expensive medication due to lack of coordination. The spacer will more effectively deliver medication to the patient and ensure that the patient is not wasting money on this expensive medication. Teaching the client about his medication allows for him to know how important they are to his health and the consequences of stopping the medication. This in turn will promote compliance and ability of the patient to advocate proper treatment for himself in the future. We would want to monitor him in the hospital to make sure that he is oxygenating properly and not in danger from preventable injuries such as falls or confusion. This allows for home treatment to be more effective as well. Teaching and performing these health promotion tips will keep the client's condition from worsening. Knowing environmental triggers in the patient's life can work for keeping his symptoms at bay most of the time. Knowing tips on how to conserve his energy will allow him to experience less symptoms as well as be better able to interact with his family. Educate the patient in regards to proper nutrition and smoking habits will involve the patient in contributing to his own well-being. Providing support in the form of a group will also aid in the success of the treatment. Overall, these steps will allow the client to have better quality of life, both physically, socially, in regards to his family, and financially.
If Jim does not adhere to the drug management regimen and lifestyle changes, his symptoms can get worse. As a nurse, we can advocate for Jim by providing a social worker or another team member that is able to help him finance his medical bills. Educate Jim about getting on unemployment, which will help him have some sort of income. Also maintain a blame-free environment and be compassionate towards him. It is important to ensure Jim stays on his regimen for new medication and lifestyle changes, because things will get a lot worse if he doesn't. Brown and Brussel explain that solutions include encouraging a blame-free environment, opting for less frequent dosing, improving patient education, assessing health literacy, and paying attention to rational non-adherence. Even though Jim is in a lot of financial trouble, his health is more important. So it is the nurse's job to provide the best care and patient education possible and worry about financial troubles once he is healthier. Patients and their health should always come before the money.
Treating JL as equal to any other patients, regardless of his financial status, is a way to help align our work as nurses with the Christian worldview. One verse that I really liked was from Proverbs 3:27-28, and it says, "Do not withhold good from those whom it is due. When it is in your power to act, do not say to your neighbor, 'Come back tomorrow and I'll give it to you,' when you already have it with you." This is basically just saying not to withhold something while they are trying to obtain it if it is already currently available. This is just advocating for patients that can't help themselves, and it is part of our jobs as nurses and Christians.
EOJ is taken twice per day and is used to open up his areas so Jim can breathe easier. Albuterol is used with a nebulizer and is only for short term. Jim needs to make sure that he takes this medication with him before doing activities.
It is important to not only teach the patient about the medications in the hospital, but also the medication that the patient is taking home. JL is taking theophylline, or Theodur, which is a bronchodilator that opens up JL's airways to help him breathe easier with his current condition of COPD. JL is taking this medication twice per day. JL is also taking albuterol, which is a short-acting beta agonist. JL is to use this with a nebulizer. Proper instruction by the nurse is necessary in order to have proper medication compliance.
Just to summarize, JL is a 64-year-old male who presents with shortness of breath, and he is coughing up green-brown sputum. He does have many economic issues which are going to affect him in his hospital visit. He was recently laid off from his job. He has little or no source of income, and he's caring for a family of 4, which requires a lot of food and money. He does not have any medical insurance, and he is not sure how he's going to pay for his medications because of all of those conflicts. And to help him get the treatment he needs, we need to help give him any resources to help pay for his care, as stated previously. And overall, the care plan intends to better clients' experience of symptoms and quality of life. As a nurse, we'll run into these situations, and we need to think about how to handle the situation as it arises.